right, so this is Bill Brower with FMBA Nation. We are live from the 2019 annual September convention here at the Golden Nugget in Atlantic City, New Jersey. And I am currently being joined and honored to be joined by Dave Forrester. He is the chairman and CEO of Integrity Health. Also being joined by Abdur Yasin, who is our State Health Benefits Committee chairman. He's on the design committee for the State Health Benefits for the state of New Jersey. And Doug and Abdur are going to talk a little bit about the new pilot program, which is the First Responder Partnership Health Center. Doug and Abdur, thank you again for joining me. I appreciate the time. Give us a little bit of information. What exactly is this First Responder Partnership Health Center, and how does it affect the members of the FMBA?
So, Billy, thank you for having us. So we've been working a number of years to figure out the ways to keep our members as healthy as possible. One of those things is and this is something that's been around for quite some time now, the direct patient-centered medical home model. Mm-hmm. A number of years ago, we started some pilots, but we wanted something that was sort of special to us, special to first responders and our particular needs, and as well as for our families as well. So, over the last few years, we've been in talks with Mr. Forrester and his organization, Integrity Health. Some of the other things that are important to us are things like behavioral health, ancillary services like chiro, PT, and so on, wellness. The issue with the other pilots is that those things were not under the same roof. Okay. You know, folks got to travel, and again, these are things that are particular
Access
to
was harder.
Yeah, yeah. And these are things that are particular to our occupation. You know, we go, from 1 to 1,000 very quickly. We want to make sure that we always have a physician available to us. Wait times are always an issue with the traditional, physician model. So again, having a pilot that is, conducive to our needs and the things that we face as first responders, even having folks to talk to, right? Because some of these things we can't just decompress on anyone. Sure. Right? So, again, we've been working with Mr. Forrester now, and I'm really excited. And he'll speak to, to this model, because again, it's strictly for first responders and their families. So.
Abdur, thank you very much, and Bill, I appreciate you including me in this conversation, and we're very privileged, to have the Integrity Health family be invited to focus on this issue of integrated care. We've had the opportunity to serve a lot of public employees in New Jersey with our partnership health centers, but as the program emerged for first responder needs, we find, in looking at the data, that there are a lot of very special kinds of needs that need focused attention by trained staff. A lot of good providers in New Jersey doing great things. Sometimes they aren't linked up very well. The communication network isn't really very good for healthcare, not just in New Jersey, but nationally. Care is often fragmented. Doctors aren't able to confer with one another. So what we are doing is bringing key primary providers together, which will include the mental health component. And that's something that's relatively new because, historically speaking, medical issues were thought of as different than mental health issues. Sure, yeah. But neurobiology is teaching us very clearly that human beings are whole people. They aren't fragmented into, medical needs, mental health needs. They really are, should be brought together. And that's what's happening now. The state of New Jersey has taken the lead in a variety of ways which make this easier. So we're very pleased that in spring we will be opening the First Responders Partnership Health Center. And I'm sure to your membership interests, it's important to highlight the fact that it's voluntary. There's nothing that's changing with regard to access to benefits or coverage or limitations or things like that. This is wholly voluntary. But like our other partnership health centers, we'll be offering doctor visit, lab, x-ray, pharmacy, physical therapy, chiropractic, and as we mentioned, the behavioral health component, which we believe is terribly, terribly important.
It's critical.
Yeah, just to sort of piggyback on that, yeah, the behavioral health component is very important. Like I mentioned earlier, you know, the things that we see, the things that we experience, you know, we want to have someone that's there and available to us. I mean, we've had a horrific incident in my town in West Orange.
Yeah.
And
Made national news.
yeah, yeah, and you know, in the coming weeks, months, years, it's going to have an effect on us. You know, it might not be something that appears right away. So, you know, it's great to have your own primary care physician, but there might be a gap in terms of, you know, scheduling time or having access to other professionals, professionals out there, particularly with behavioral health. So again, this is something that we're doing here. I think it's the first in New Jersey. It sounds like it's one of the first in the country.
Yeah.
And this is cutting edge. This is us pushing the barriers here. The other piece of it is, and I was speaking to Billy about this earlier. So on the design committee, you know, we make changes as we do. We all know about that. With this particular pilot here, there's going to be an oversight board with the first responders represented.
Sure.
So there's no gap in terms of, you know, if we need to make some adjustments, some tweaks or whatever, we can do it fairly easily. You know, it's something that, and please, Doug, please speak to that.
Yeah, I think it's important to highlight a couple things. Abdur. One is that the state initiative for the First Responders Partnership Health Center is a critical pilot program of the State Health Benefits Plan. And we will be focusing on that, and we're very excited to interface with the state, give a lot of credit to their initiative here. Because the state, you know, I think is really waking up to its leadership role. You know, way back in a former life, I used to be the director of pensions and healthcare for New Jersey, and I always marveled at the fact that the theory is to bring first responders in young and then move them out young, you know, through a pension system that moves in that direction. But what really we never took into account is the toll that first responder duties take on not just the first responders, but their families as well. We're understanding that now in the medical industry about just how much damage can happen. And part of the reason why on the behavioral health side, the mental health side, that has medical downstream consequences, we need to pay attention to this is because for the sake of those first responders who are retiring, you know, we owe it to them. To put them in a better position, a stronger position. The nice thing about this First Responders Partnership Health Center is that it's not open only to state covered members. In other words, the State Health Benefits Plan is an important component, but it will be open to all first responders, and we're pleased about that. So we're expecting quite a bit of attention. We're eager to be of service, and again, it's voluntary, but I'm confident that as time goes on, people will find this will be the place to be their medical home.
That's correct.
Yeah.
So, yes, as far as folks that are in the state health benefits program, obviously they have access to this. The copays are zero. Okay, but for folks that are not, they can still go to the center here.
Sure.
They would just pay whatever their copays are
is.
for primary care. So in certain cases, it might be $10, it might be whatever. So again, there's really no barriers to access.
Right.
The purpose here is to have very easy access and one-stop shopping for all the services that I mentioned. I mean, you know, what we find is that, you know, people are spending, you know, 15 minutes to go to one direction to see a doctor, and then driving another, you know, 20 minutes to get lab work done, and then maybe picking up a prescription and in a different direction, and maybe some, you know, physical therapy has to occur, or some you know, behavioral health therapy. By the time you add up all that running around, you know, you're out in more than an hour. What we're trying to do is to have same-day appointment for all these services, and the value of the care coordination of all those services with specialists on the outside. So we will be interfacing with hospital systems and specialists in order to give the first responders the best and their families the best possible integrated healthcare experience.
So let me try and simplify things for some of the listeners, some of the viewers on this. Give me a scenario on how one of our members or a first responder, how they would actually access this. What's the process? Do they have to go to a general practitioner first and then get a referral? Do they go directly to the center? How does it work for, in layman's terms, how would one of our members take advantage of the services?
Because it's voluntary, they would choose to come. There isn't any gateway that they've got to go through first.
Okay.
This is a primary care facility. In other words, very robustly defined, integrating a lot of services, but nonetheless it's primary care, and they would make an appointment and come in. So that's what makes it so easy.
Sure.
And I've had a lot of people say, gee, I feel like I've really got good benefits. My union's done a good job for me in giving the benefits, developing them. But, there's shift work. I sometimes don't have access. On paper, it looks great, but it's access out there in the marketplace. So what we're trying to do is to bridge that gap, make sure that people have easy access, which also prompts me to say that we are beginning in the spring with a site in central New Jersey for beta site purposes, but we expect to expand to have other areas of New Jersey included. We're not trying to leave anybody out. I was with some folks from Bergen County the other day, and they made it very clear that they expect me to perform up there for them as well. So I expect that we'll be able to do that, and we're excited. One step at a time, but this advisory council that Abdur mentioned is important, not just from the state health benefits plan piece, but we've collected the leadership of the first responder unions into an advisory council to hold us accountable.
Sure.
This isn't going to work if we think we know better than your elected representatives. We want to hear candidly on a regular basis, are we doing what's needs to be done? What other kinds of things can we add? So this is very much of an organic, active, dynamic relationship that we have with the union leadership, and we're very pleased about it.
Yeah. And also, one of the things that I like about this advisory board here is that we'd have access to data. All right? Look, our population experiences things like cancers,
Sure.
other conditions, more than other populations. Maybe out of this, we'll see some trends happening, and we can tackle those things.
Yeah.
Right? So, again, this is something that's cutting edge, right? This is something that should be done for across the board, but the FMBA is the one that's, as well as the PBA and our state police, we're the ones setting the trends here.
Yeah.
It's the focus on health that I appreciate very much, during just what you're saying about the union leadership direction. I've done a fair amount of speaking in various places around the country, and I often ask the audience, well, why do you have a health plan? And they will look at me in kind of a puzzled way, like, what are you talking about? We have to have a health plan, or well, it's negotiated, so that's why we have it. Or if somebody's had lunch with an actuary, they might say, well, to recruit and retain good employees. Those are answers, but they're not the right answer. There's one reason why an employer should offer a health benefit plan, the underlying foundational reason, and that is to make people well, to facilitate health for employees and their loved ones so they can be productive at work and play. That's it. And if you're not able to measure the success of your health plan in those terms, then why spend the money that way? So this focus on health outcomes, of how to optimize a health pathway so that someone is able to enjoy not just their active life, and their family, but afterwards as well. Again, the toll that first responder duties takes on the bodies and the emotions, the minds of first responders can be terrible. And we're trying to break down these artificial barriers that keep first responders from getting the attention they need. We want the stigma about counseling to be completely eliminated. Everybody needs counseling, in my opinion. One of the reasons we started down this path is because we found that nationally, about 40%, that's 40%, of primary care physician time is spent counseling. that just blew my mind when,
Wow.
when I realized that our medical directors were experiencing the same thing, and then I thought, that is an inefficient way of providing counseling. One is that physicians need to be dealing on the medical side, and secondly, there are people who actually are trained better on the mental health side, behavioral health side, and we need to get people quickly into those hands so that healing will begin, or some sort of attention can be given to problems before they really emerge. Again, it's not just the first responders, it's the impact of their frontline duties on their families. We want everyone well.
So let me kind of wrap this up a little bit by first of all thanking both of you taking the time out of your day to sit down and talk to us about this very important piece of information that needs to be delivered to our members that are in attendance, that are not in attendance. But if somebody wanted to learn more about this in particular, what's the best resource for them to get in touch with, or what's the best way for them to get the information?
I'll be pushing out information as I get it. Our target is for the spring of 2020. Once it's up and running, my suggestion is to go down and check it out.
Okay. Is there going to be a website or any kind of online information they can go and visit to?
Yes. Currently, Integrity Health has a website.
Okay.
I'll get that information out. As far as the URL.
Right.
But again, I've been working with Doug now for a number of years. I went down to his facility in Long Branch, and again, it's tapered to the school board population there. So again, I'm very excited. Very excited about this.
Yeah, no, it's definitely exciting for I think everybody involved, and I really think it's going to have some positive effects on the first responders here in New Jersey. So, Doug, I appreciate your time. Thank you so much.
Appreciate your time and attention.
Abdur, thank you.
Got it.
Thanks so much.